Single-payer healthcare is a policy where the government pays for the healthcare of all residents. The U.S. currently has a multi-payer healthcare system with public and private insurers. Residents have different levels of access to healthcare depending on benefits offered by their coverage. Those who cannot afford private insurance and do not qualify for public insurance are left uninsured. According to the U.S. Census, there are 28.5 million uninsured Americans. A single-payer system will provide universal coverage and offer the same level of medical service for all. Single-payer healthcare operates in various forms among many industrialized nations. It currently exists in America only as ideas in proposed bills. According to the U.S. National Healthcare Act, introduced in the House of Representatives, the American version of the single-payer healthcare will cover primary care and prevention, prescription drugs, emergency care, long-term care, mental health services, dental service, and vision care. There will be zero deductible, zero copay. All costs will be covered by taxes. Patients will choose from participating physicians in any institution receiving public funding. Institutional providers must be public or nonprofit. Institutions that switch from profitable to nonprofit will receive compensation. Non-institutions such as physicians and clinics can continue to be private but cannot be investor-owned. Private insurers will only be allowed to offer benefits not provided by the government, such as non-medically necessary cosmetic surgery. As of 2017, the bill in the House has 120 co-sponsors. The parallel bill in the U.S. Senate has 16 co-sponsors, all Democrats. A few states have passed single-payer healthcare legislation, but none have successfully implemented a plan due to budget constraints. Cost projections range from Bernie Sanders' estimate of $1.38 trillion, exactly the same as the current annual federal health spending, to the Committee for a Responsible Federal Budget estimate of $2.8 trillion a year. Public opinion is divided along party lines. Responses in general are more favorable when the system is described as expanded Medicare, so the single-payer healthcare is also referred to as Medicare for all.
So one positive factor about single-payer healthcare is that no one will be denied access to healthcare. The healthcare will be viewed as an essential collective right for all people. Also, it would be affordable. Americans will be saving more money. If healthcare costs are more inexpensive, it will be less stressful, and citizens would have to worry less about healthcare costs. Another positive factor is patients would be free to choose any physician or hospital in the country. Also, expand preventative healthcare. The lack of healthcare for some low-income families is related to the government's inability to provide primary prevention. Having preventative healthcare could help save lives of many people by detecting illness early on, and also education on, for example, disease prevention and so on can be beneficial for individuals and families. Also, providers of patient healthcare would see significant reduction in paperwork, having to interact with one health plan instead of a numerous amount, like we do now. Lastly, facilitating comprehensive health planning. So, for example, regional disease management programs, cohesive approach to distribution of innovative healthcare technologies, and also strategies for solving physician shortage issues.
Go.
So, the country of Canada has single-payer healthcare. So, Stefan mentioned this earlier, but even if they have high expenditure and they pay higher taxes, they enjoy better health outcomes at lower costs, unlike the USA. So overall, the American government spends most of its money on healthcare and Social Security based on the federal budget of 2018, as we learned from one of our discussion boards in class. So if they already are spending so much money for healthcare, why not create it equal for all citizens, regardless of SES or other factors? The government creates these programs and services for us citizens, the people, and we pay, and our taxes go to these services and programs. So why not the government help us out if we help them out?
The negative aspects of single-payer health care is first, under a single-payer plan, citizens may not receive the healthcare services that they want or need. Rationing is all too common because the government is responsible for setting parameters on healthcare spending. If implemented, the government will become responsible for financing nearly all current healthcare spending. Thus, they may not approve certain healthcare services because they are not cost-effective. This may significantly limit patient access to care and contribute to poor health outcomes. Rationing healthcare could significantly reduce the number of participating physicians in hospitals. In most cases, citizens prefer to receive services from physicians in hospitals with whom they believe best suits their healthcare needs. Many individual physicians in hospitals may forego providing services to citizens under restrictive conditions, especially if they believe that the government would tightly control and devalue the practice of healthcare administration, or if they know that private insurance will pay more for these services. For example, the Veterans Affairs healthcare system is a single-payer program that is funded much less generously than private medical providers. That means VA doctors earn substantially less than other physicians, making it hard to fill vacancies. Single-payer healthcare may increase service providers' administrative burden. If all goes to plan, there will be millions of Medicare for All enrollees receiving services. Providers will be required to complete and submit a great deal of paperwork to the government on behalf of citizens. So this may add to the administrative burden instead of reducing it. The need for healthcare doesn't make it a right. The push for a single-payer plan may declare healthcare as an essential right, but all citizens may not receive quality healthcare. Current healthcare spending accounts for nearly 18% of our GDP, and with a projected increase of approximately 12.7 in 2031 and continuously rising thereafter, it's hard to deny that in our society, healthcare is viewed as a valuable service and good in our marketplace. Thus, we tend to pay more for it. Quality healthcare is valuable and costly because it's hard to come by, and the demand is high. And for this reason, individuals must be responsible for investing in their own healthcare needs, not the government. Single-payer healthcare would be a universal benefit, but it will place a financial strain on an already strained federal budget. $7.65 trillion annually will be spent on healthcare by 2031. It would add approximately $32.6 trillion to the federal budget during the first 10 years. Income and corporate income taxes would drastically increase to fund it, thus middle and high income citizens will pay more. Furthermore, it isn't affordable for everyone because once again, individuals have different healthcare needs. If it doesn't adequately cover healthcare according to citizens' particular needs, they would either A, have to go on living without it, and in the worst case scenario, maybe not, or B, pay more money for private insurance. This would defeat the purpose of buying into a Medicaid for All plan.
Our recommendation is to successfully implement a version of single-payer healthcare in the United States. We can learn from Vermont's failed plan to implement their Green Mountain Care. In 2011, Vermont created their universal healthcare coverage for all their residents. However, in 2014, they abandoned their plans. Universal healthcare can be successful if we learn from a few of Vermont's mistakes, such as Vermont only had platinum plans, where their state pays 94% of their healthcare costs. In the new one, the program should allow consumers to have some control over their coverage. Another issue was officials did not know where the state would get the money for their insurance coverages and were unable to tell their residents. People should know how and where their government is getting the money to cover their healthcare plans. And a third mistake is doctors and hospitals did not support the plan due to reduction in payments to them. Hospitals and medical centers need to support the plan and see benefits for the provider side also. So in order to implement universal healthcare coverage, there are a few different ways to do it. An article by Richard Boudreau in 2017, The Plausibility of Universal Healthcare in the United States, proposed an idea similar to single-payer healthcare. They called it national health insurance. In addition to having the ideas of universal health care, it also holds similar themes to Obama's Affordable Care Act, such as guaranteed eligibility, comprehensive benefits, and affordable premiums, copays, or deductibles and subsidies. The development of this new plan will address the health and insurance needs of the public by reducing the administrative health costs. In order to minimize costs, there is an emphasis on state and local government participation through administration. Some goals of this new plan would be to provide health care and incentives for costly expenditures, to reform mark-based insurance systems, and push insurers to pursue high-end insurance options for non-covered conditions, to reduce administrative waste, to align patient needs with the activities of healthcare organization and providers. Some components included in this plan are reductions in Medicare and Medicaid payments, an increase in taxation for employers, and lower payments to hospitals and providers based on a pay-for-service system with cost agreed upon at the state level. If all residents are covered, there would be a decrease in expenditures related to the unpaid bills of the uninsured and underinsured. His plan also focuses on preventative care. This would allow for reduction in payments by Medicare and Medicaid for preventable catastrophic illnesses, reduction in unneeded services, and the increased use of innovations which will improve efficiencies. Since administrative costs are a large portion of healthcare costs, he proposes to improve the use of electronic medical records, reduce the cost of fraud to the federal government, and improve billing and administrative processes.